My name is Angela Zina, and I'm going to be doing a pickle line dressing change. I'm going to gather all my supplies and go into the patient's room. And when I get into the room, I'm going to introduce myself. I'm going to ID the patient, name, date of birth. I'm going to ask if they have any allergies. At that point, I'm going to hand hygiene with hand sanitizer and put on clean gloves and a mask. I'm also going to ask the patient if they would like to wear a mask. If they will, I provide them with a mask. If not, I will have them turn their head away from where their PICC line is and keep it that way until the end of the procedure. So I put my clean gloves on after I hand sanitize. I'm going to look at the PICC dressing that's already there and assess it, see what needs to be done. If it has a clamp, I will clamp that. I'm going to want to measure from the insertion site to the end to see how long my PICC is, and to make sure it doesn't move within the procedure, or it hasn't moved on its own, just being in the patient's arm. So I will measure it. I will write that down, and then I'm going to remove the old dressing. I'm going to, with a alcohol swab, wet around the edges to help pick it up and ease for the patient. But I'm going to want to peel it towards the insertion site as to not pull out the PICC. So I'm going to pull all around and take it off. At this point, I would have a trash can next to me and I would discard it into the trash can. Some PICCs have a stat lock, some have a permanent ring that stays there throughout the PICC. If it has a stat lock, I will remove that as well. Okay. Then I will take off my clean gloves. Throw those in the trash. I will hand hygiene again. This is my sterile field. My sterile kit is open. My gloves are here. This doesn't come with a drape. If there is a drape in it, I can drape it over the PICC as to cover all the other parts of the arm except the PICC itself. So at this point, I'm going to put my gloves on. So I have my sterile gloves. I don't want to drop them any part below. I would have a table that is higher than what I am using right now. So once the dressing is off, we are ready to clean and reapply another dressing. So I'm going to take the chlorhexidine right here. This pinches and it releases the cleaning solution inside. And for 30 seconds, I want to scrub around the PICC area. So I'm going to scrub up and down, side to side, all around where the PICC is. If you have more than one of these, you can option to clean the line as well. And then I would discard this in the trash. I'm not going to throw it in my actual trash can. I'm going to act like my trash can is right here. So I would discard it in the trash. And then I would wait for that to dry. That would take about 2 to 3 minutes to fully dry. Once that is fully dry, then I would take the skin prep as well. Here, open it, discard the trash. I'm going to act like this does not have wrapping on it. And I would clean the whole area where not clean it, I would apply this to the whole area where the tegaderm is going to go. So then I would apply this all around, not to get it on the PICC line. and then I would discard this in the trash. I would have to let that dry as well. If that does not dry, nothing is going to stick to it. At this point, if there is a securement device that is to go on, I would take the securement device and attach it to the PICC line and then to the patient's skin. I do not have that in here, but that would go on next if I do have that. After the securement device, then I would take the Tegaderm, peel this apart, and place it on the PICC line. I want the PICC, the insertion site of the PICC in the window. And then I would apply that, and that would stay there. Once that's applied, the PICC line that needs to, the part of the PICC line that needs to be covered is now covered. I would then take the caps off and clean the end of the PICC. If it is more than 1 lumen, you do 1 lumen at a time. If it's a single lumen, you do only that lumen. So I would take an alcohol swab, say this is an alcohol swab, and I would cleanse the end of the cap. Say about 10 seconds, 10 turns. Some of them have the green caps that go on the end that keeps it sterile, some do not. It depends on your facility policy. We clean it. And if the PICC needs to be flushed, you can flush it to make sure it's still flushing well. And discard that. And then we can go ahead and label the dressing. The Tegaderm does come with a extra piece of adhesive to it that you can initial, date, and gauge it for the PICC and place it on the PICC as well. After the labeling, the PICC is pretty much complete. You want to clean up your whole area, discard whatever you don't need, and then you want to make sure the patient remains in a comfortable position. If they're not comfortable in what they are, how they're sitting, you can readjust them. Then you want to remove whatever protective area you are wearing. I'm gonna, for the sake, I'm gonna just place this back in the sterile field. And then once all the PPE is removed and everything is cleaned up, then you would hand hygiene one last time, which, you know, you can use hand sanitizer or you can soap and water at this point. And that is a PICC line dressing change. Thank you.